The next thing I wanted to talk about is about how opioids work, how buprenorphine works, how pain works, and those sorts of things. So in your brain and all over your body, you have billions of nerve cells. And so I'm going to show you a nerve cell as my fist. And on the surface of those nerve cells are a bunch of proteins. They're receptors for different molecules that the nerves use to communicate with each other. So there's serotonin, which is one of these neurotransmitters, which is like how Prozac and Paxil and some other antidepressants work. And there's norepinephrine, which is how other kinds of antidepressants work. And then there's dopamine, which is involved in schizophrenia and Parkinson's disease. And there's the GABA receptor, and there's glutamate, and there's all kinds of different neurotransmitters that your body uses. But one of the receptors that we're interested in is the opioid receptor. And so that opioid receptor is called the mu receptor. Now, normally in your body, you produce endorphins and enkephalins in your brain, and those come and they bind that opioid receptor. So when you laugh, or you win a prize, or you have sex, or you exercise, or whatever, your body releases endorphins and enkephalins, and those bind that opioid receptor, and you have the result of feeling relaxed, or feeling well, or those sorts of things due to the effect of the enkephalins, endorphins stimulating that opioid receptor. Now, a couple thousand years ago, somebody found that if you take the juice out of an opium poppy pod and you take that stimulates the hell out of that opioid receptor. And so what happens is you get an intense sense of euphoria, relaxation, pain relief, those sorts of things. And from the juice from the opium poppy, we've developed opium and heroin and morphine and oxycodone and all those medicines that are termed opioids. Now, most of the ones that people have heard of are full agonists, meaning that when they bind the opioid receptor, they stimulate it 100%. And the nerve cell doesn't really like that. It's used to more mild stimulation from the endorphins and enkephalins. But with the full 100% stimulation, the nerve cell responds by changing the receptors. Now, there's some scientific uncertainty as to what exactly happens with the receptors and how it changes the body. But the way that I explain it to people is this way, that the receptor is produced by the nerve cell at a greater extent. So you get more and more receptors the more opioids that you use. And so gradually you need more and more and more to have the same effect. And so the nerve cell ends up being covered by additional opioid receptors. So that in order to have the nerve cell have 100% stimulation, you have to have an opioid on a lot more receptors, so you need more of the medicine. Additionally, if you take all the opioids away, you take all the oxycodone or heroin or whatever away, and you have all these extra receptors, well then all the receptors are empty, and the nerve cell starts experiencing withdrawal, and then the person goes through withdrawal, and they have sweats and chills and anxiety and muscle aches and goosebumps and runny nose and tears and nausea and vomiting and diarrhea and stomach cramps, and the whole opioid withdrawal syndrome occurs. Now, so in comes buprenorphine, which is included in products such as Suboxone, Subutex, Bunavail, Zubsolv, the patch, which is called Butrans, and so it's also available as an injection and those sorts of things. So buprenorphine comes in lots of forms, and it is an opioid. So if you take opium and you chemically modify it, you get another drug called thebaine. And if you take thebaine and you chemically modify it one way, you get oxycodone. If you chemically modify it another way, you get buprenorphine. So buprenorphine and oxycodone are actually highly chemically related. The difference is that, of course, oxycodone, when it binds the receptor, it binds it 100% and stimulates your nerve cell 100%, and gradually more opioid receptors are produced, and you have tolerance. Meaning that you tolerate a greater dose, and you need a greater dose to have the same effect, and then if you take it away, you have withdrawal. Now, buprenorphine is what we call a partial agonist, so it binds that receptor very, very strongly, and so it does not come off easily, which gives it a long half-life. So once you take it, it lasts a long, long time in your body, unlike some other opioids. but it only partially stimulates the receptor, more like the endorphins and enkephalins that your own body produces. And so you do not typically get more and more receptors being produced. So normally people who start on buprenorphine have a lot of extra receptors. They already have tolerance, although you can start it in people who have no tolerance at all at a much lower dose. Generally, we start in people who already have tolerance because they have chronic pain or they have opioid dependence, etc. And so the buprenorphine binds those receptors and partially stimulates those receptors so you don't have withdrawal, but you also won't develop greater and greater tolerance over time. And so over time, because the nerve cell feels more naturally stimulated like it would with endorphins or enkephalins, those receptors are taken down, and gradually you can reduce the dose of buprenorphine over time very slowly without withdrawal, and eventually your nerve cell gets back to normal and you don't have withdrawal and you don't have tolerance anymore. Although you still have the memory, if you're struggling with chemical dependency, of using chemicals to solve your emotional issues and to cope with stress and those sorts of things. So the memory of the use doesn't go away, but the tolerance does. And so you can taper off of buprenorphine over time, although work on stress management and coping skills, which is the cornerstone of treatment of chemical dependency, that still, of course, needs to get taken care of. But for those people who struggle with chronic pain, who do not have chemical dependency or haven't developed chemical dependency yet, as some of them will, you can, if you're already highly tolerant to opioids, you can take buprenorphine and gradually taper off of pain pills without going through withdrawal, which is what a lot of my patients are interested in doing. They've gotten to the point where they're tired of the pain pills, they're not sure if the opioid is helping them at all, and they want to get off.